Okay, this is exercise number 6 from your worksheet. Here's another quintessential chiropractic adjustment. In this case, we've got Maria on her side. I've got the centerpiece lowered a little bit to induce just a little bit of lateral curve here because I find that that helps. We're going to do the lumbar part first. The contact is going to be the pisiform on the hand closest to the patient's feet, and on the patient, the contact is going to be mammillary process. Now, in most cases, you can't actually palpate the mammillary process. But remember that the SPs in the lumbar spine are much less anomalous than the SPs in the thoracic spine, and usually the SP that you contact corresponds to the vertebra that we're trying to move. It's the same bone. So in this case, we're going to find that SP with the pisiform process, move up just a little bit so that you're just slightly lateral to the SP. Now, the reason they talk about pushing on the mammillary process is because the lateral processes of the lumbar spine are very wide and they're thin and they're actually quite brittle compared to a lot of the other structures here. So you don't want to be way out here pressing on the true transverse process of the lumbar spine. You want to get in very, very close to that SP. Make your contact, get your elbow out here, rock that patient into rotation just a little bit, and this thrust is going to be pretty much a combined move of a body drop with your chest on the patient's hip and a little thrust from the hand, and it looks like this. Now that actually cavitated at least the joints above and below my actual contact. There's nothing wrong with that. We try to be as specific as we can. What you want to do is, if you have ancillary cavitations, that's nothing to worry about, but go back and check to make sure that you have the mobility that you were looking to induce here, that whatever fixation lesion you were after actually did cavitate. Now, to practice for that lumbar roll or side posture lumbar adjustment, we're going to hold the bottom of the instrument in our left hand. We're going to make that same contact with our pisiform process on the top of the unit here. And remember, we've put a little graphic here. The only reason it's there is to remind us that we want as tight a placement as we can possibly get with our hands. We want to be as specific as we possibly can be when we make our adjustments, especially when it's a bilateral adjustment. So if you have large hands like mine, sometimes you want to make a single contact, put the other hand on top for reinforcement. But in this case, I'm just going to stabilize the unit here down on the table, because remember that thrust was in an oblique plane here with a body drop. So you can actually perform both things at the same time. You go in, get your cue to thrust, and drop. And remember, this is the one where beginners tend to make the mistake of losing that tissue pull. In side posture, tissue pull is probably more important than in any other adjustment because there's just so much more of it. We've got to take out all of the slack until we find our end point and then thrust from there. And again, once we get our groove, we're going to go for speed. Now, I'm not only dropping like this, but I am also using my hand to produce a thrust.